Ashley Pastor says she felt a combination of fear and dread going back to the emergency waiting room at Dartmouth General Hospital, only 3 hours after she was discharged from her laparoscopic abdominal surgery.
You feel so unseen, and it's so incredibly frustrating, so unheard, and you have no recourse.
On Monday, Pastor was brought by ambulance to the ER for severe abdominal pain, and around 9 p.m. was told she was going in for emergency surgery. She went under later that night and came to in the early morning hours on Tuesday. The surgeon had removed some bowel adhesions, which they determined were causing the pain. Later that morning, staff began prepping her to go home, but Pastor wasn't comfortable leaving so soon.
I was concerned about the swelling. I was concerned about the pain. I was concerned that I hadn't been able to avoid my bladder. And they were just like, yeah, that's fine. The care up until my surgery was actually surprisingly great. And then once it came to discharge, it was, oh, you're not bleeding, you're not dying, get out, somebody else can take your bed.
Pastor, who lives alone, was sent home to recover Tuesday afternoon, but says when her abdomen swelled up to the size of half a volleyball, she was told she would have to return to the ER waiting room. She says she waited 6 hours before eventually seeing a doctor late Tuesday, but feels the entire ordeal could have been avoided.
Given the fact that I had just been in the ER, having to be retriaged, sit in a waiting room, and be reassessed just felt pointless.
In a statement, Nova Scotia Health tells Global News how long a person will have to stay in hospital after surgery will depend on the patient, the type of surgery they had, and how quickly they heal. In many cases, patients are able to be discharged the same day as their procedure, even for significant procedures. Others need more time to recover in hospital according to the nature of the surgery and the person's own health status.
The doctors, the nurses, they're all overworked. It's not that they aren't trying. They're making the decisions that are necessary to make given the circumstances, which is abhorrent.
Pastor was readmitted to the hospital Wednesday afternoon and is waiting for next steps. MacDonald, Global News, Dartmouth.